Thank you very much.
Thank you. Good morning. Thank you for attending. My name is Harrison Pierce. I'm the Chairman of Health and Human Services. Let's see the agenda. So I realized at the end of the last meeting, we did have a consensus to focus on the role of the committee at this meeting. So with some abbreviation of staff reports, et cetera. So I did ask Jen and Beth if they could just highlight the issues in about a 5 to 10 minute framework. There are a couple of business items we have to deal with. The rest, the grant issue is of December. Yeah, we'll
Thank you.
roll that over to them. And I think we'll have lots of time to discuss the role of the committee, and Jim did forward a few ideas of his. We addressed. First item on the agenda is approval of the October 6th minutes. Any corrections, questions, comments?
I make a motion, Russ Park, Self Commissioner, to approve. And thank the minute taker. as
All in
well.
favor? Thank you. Reports, Health Department, Jen Allison.
Okay, before I start, I brought Gino, my new sanitarian, we hired from
We never know.
Sullivan from Bridgefield. So he's replacing Chris Weggers in, who went to Reading for the 4-day work week and a little shorter commute. So happy to have him on board. It's been a rough couple of weeks for me drowning.
Great, you're all set. Where do you live, Chris?
I'm Gino.
Gino, I'm sorry.
Yeah, I took Chris's spot. I live by Chester. I live far away.
Oh,
Pick him up.
it's a pleasant drive, though.
Yeah. But I worked in Ridgeville for 8 years. I don't mind commuting.
Good to have you.
Thank you. Nice meeting you.
So updates, you all got my written report of all vaccination data. In October, CDC and FDA approved the 5 to 11-year-old group for the bivalent booster. The only difference this time is they also included a Moderna approval. So the Moderna for the 5 to 11 age group is just half the dose of the adult dose. So that is a change from the past, so that's good. So now parents have 2 options. The health department also is doing flu clinics. We did at the high school, we for Janet Reed and all the staff, we did over 300 then. On every day we're doing flu shots because the parents are having a hard time getting into pharmacies and stuff. New Canaan Pediatrics did about a dozen clinics and people are still having issues. So the flu is ongoing. The good part about the flu is they're individual doses. So you don't have to worry about wasting vaccine, and I get unlimited from the state. So I'm not worried about that. I can order as much as I want throughout the season. Updates for environmental. We're already beginning to get an uptick in lead cases in January. What I mentioned last budget year about changing the regs going down from 5 to 3.5. The providers have already been, getting notified of that. So they're already beginning the referrals. I had 4 in October. I just got 4 more yesterday alone. So in lead cases are very labor intensive. So that's going to be quite a drain. Luckily, Gino's certified just like me. So he'll help take on that burden with me.
How many houses in the Canaan have lead?
Anything pre-79 has lead.
Okay.
The only difference is if you have a child under 6 in residence. So
You paint it over it in latex.
it doesn't work like that.
No.
No. That'd be great, but no. The EOC2 grant update, finally I have good news. The Attorney General approved it last week. It's all signed, the contract executed, Kevin approved it. So the check's on the way, and that's great news, and that covers 3 of my nurses. That grants are all updated and been submitted, so that's great. Restaurant relicensing has been sent out. That's due by December 31st. Next week, Shannon will be taking the QPR mental health suicide train to trainer course for local health, which is pursuant to Public Act 21-46. So once Shannon gets on board, me and her will both be the certified trainers. We did order all the books and all the material, which again, another unfunded mandate that has to come out of my budget with, squeezing pennies out of. Monkeypox, we still have no cases, so that's good news. I gave you guys some data on the hospitalizations of flu. The bigger problem is RSV. We had a meeting with the hospitals last week, the directors of health. And RSV is really overwhelming the pediatric ICUs in Connecticut and across the nation. There are some RSV vaccines that some are ready to go before FDA for approval. Some are still in clinical trials, so who knows what's going to happen there. And we're still doing obviously COVID testing. Testing numbers are down. We'll see what happens with the holidays and then reevaluate in January if we continue with PCR testing or not. We'll still always have the rapid testing because we have the CLIA waiver. And the PCR testing, we're not paying, so it really doesn't hurt us, but we'll reevaluate that in January. So that's the crux of it all. If Harrison wanted me to be quick. Yes, Jim.
Jim, last week, I saw a thing on TV that said only 6% of people over 65 nationally were getting the booster shots on COVID, which has always been the major vulnerability of deaths.
Oh, that's the.
She said,
bivalent.
yes, number 5. The state doesn't take age into account, I guess, anymore is the way to say it.
Well, they don't extrapolate it. So when they have on their data, they just have with booster dose. They don't say what number booster dose. But if you had your 4th or 5th dose, you don't count towards increasing that number. It just starts with that third dose. And as you see, the children, really, the younger age groups really have not been that into boosting. The babies, that's another thing I forgot, that they're going to be up for boosting probably in January. That's towards the end of their clinical trials. But as you see, I mean, we have one of the highest numbers in the state at around 33%, and that's low. So
Hard as it is to believe, I hang around with a lot of seniors.
well, it's funny, you'll see on my the outfall I do tonight.
I'm sorry to see it. That's my choice.
Well, and we're getting more and more cases in the 16, 17-year-old group, which is kind of funny.
Well, and basically what I was going to respond to is that a number of the people that I hang around with or see in the course of the week are saying, I'm not going to get that 5th shot because I've got a flu shot and I got this shot, a single shot. And so there's this issue of wear out of vaccination. And at the same time, one of the things that was on this program was saying the high vulnerability, if you don't take advantage of these boosters, you're shot.
Yeah, because if you look at
Possibilities are-
the data of the variants circulating around that I provided to you, it's BA4 and BA5, which is what the bivalent target. But I did have a lot of people tell me that they're waiting to closer to the holidays because they want optimum protection, kind of like what people do with the flu.
Yeah.
Some wait longer and go later on into the season, so we'll see what happens. We'll still be offering it, so people can always go to us no matter what.
I think what's also contributing to these numbers is, all of our population under wave and E has been fully vaccinated. All the seniors, thanks to Jen and her group, except maybe 2 have turned it down. And we're still testing all of our seniors. So half of the people that you see here that are in that age group are asymptomatic and they did not have any idea they had it, but because we were testing so frequently, it popped up that they were positive. So, and we're seeing more and more people coming from the hospital that are quote unquote negative, but are flaring up on day 1. So we keep them in quarantine. So things like that are still occurring, which reminds me of the good old days when first weeks of COVID, right?
Jared, for the 5 to 11-year-old range, do the pediatricians and pharmacies have that shot, or do they have? to
No.
go department?
No, the pharmacies won't even do flu with most of the kids. And they don't do the COVID, and the pediatricians still are not licensed COVID providers, and they're so overwhelmed with RSV. I have a great relationship now with all the pediatricians in town, that, you know, you handle the actual sick, I can handle, you know, the vaccination. You know, and that's like with the lead cases now, where we have such a great rapport now that even though the law doesn't go into effect until January, we might as well nip it in the bud now and help these parents identify what the sources of lead are, because any amount of lead can cause long-term cognitive issues in children, especially when they're really young.
What's the count of RSV patients? Is that a countable, that a reportable
It's a
disease like flu or COVID?
it's reportable, and I had nice slides from the hospital presentation, but they won't let us share it, it's confidential. But the numbers are sky high compared to flu and COVID, and you see when we went to school, how it changed in the chart. Because in September, it was COVID that was through the roof, and then it's now become RSV through the roof and COVID.
How high is that?
The fact that Yale wants to set up a temporary hospital in a temporary tent, that's high. They're asking for FEMA's help, is how bad it is.
How are the kids faring? They're sick.
They're okay, but I mean, it's a lot in the hospital, it's all, you know, there is no actual cure. So it's all just kind of treating symptoms and managing, you know.
The younger you are, the more problematic are. And I don't think we've ever seen anything like what's going on now in the last millennium with ours. COVID, Janet Reed, supervisor at public schools, emailed me yesterday that the numbers for COVID are in October, but they are up in Norwalk Hospital, probably the same standard. And then 9 to 17 range, not like it was in yesteryear, but it's going. Thank you, Jen. Bethany?
Let me see, so you got the report
Yes.
for October. I wanted to add, Silver Hill gave me the numbers for the urgent assessment program that I did not put in your notes. So this is based on the launch of July 7th up until the end of October. And the total calls are 53 calls have come in, and that's 11 for the month of October. So a total of 46 cases to date. When I last spoke, it was 36 in September. 10, well, like 35 in September, up 10 to 46. Average, they're getting an average of 3 to 4 a week for their calls, and the cases that have come in, the most inquiries have been appropriate, and they're on target for the program. So the word is getting out on what basis this program is built upon. Let me see, the age range, this in October was 11 to 60. The overall range since July is 11 to 82. And the primary complaints continue as depression, anxiety, followed by suicidal ideation of varying degrees and severity. Let me see. Substance abuse still has been proportionately less. But they've seen a few cases where it has been the primary concern, and they continue to partner heavily with the middle and high school system for that and private schools in the New Canaan area. And so they're very pleased with this. Wilton has been, I've been in touch with the health director. I'm hoping, you know, something can go on there. They seem to be gravitating towards an interest now in hearing about the program. So I'm hoping maybe something can be done. The July 7th launch date, that the ARPA funds have been set for that 1 year, 250,000. So the new grant writer that came on last week, Greg Riley, he came on Thursday, Friday, I had an appointment with him and discussing a couple of things. One is this ARPA fund or the 250,000 urgent assessment.
Yeah,
Yeah, it's great. Yeah. And so I guess we stole him from Stratford. I think he was great right in Stratford. So he came down and he is working. So we're hoping to see what type of funding we can possibly get, grant. He's looking into that, so I'm working on that. The other thing is which I haven't heard from the Board of Ed yet, Brian, that he's trying to figure this out. We have on the grant requests, Kids in Crisis of $96,000 that they're requesting this year, and we're gonna go over this in December. But just to let you know, the Board of Ed ARPA funds had a 2-year commitment for the Kids in Crisis SACS counselor. We're paying, the Human Services is paying for the high school counselor. That's another $96,000, but they agreed to pay for 2 years. Last year, they were not able to hire, they could not find an appropriate counselor. So I'm asking for the 2 years to be extended since we didn't pay for the first year, so we can get the 96,000 for the SACS teen talk counselor to come on, so at least we have another year. If they decide not to, we're gonna have, what is it, $192,000 grant request from Kids in Crisis to cover both.
I think
So,
sorry,
yeah.
you think we could have them, somebody from Kids in Crisis, one of the counselors come in and talk to the commission.
The council, yeah, and we could do that,
I think January, I'm not saying.
yeah, and yeah. Did Kids in Crisis, did we have them come and speak? Maybe it was before we go.
We already done.
Spoke to you and me and.
Yeah, but let's do something like that now that we have.
Well, it's such an important activity.
It's
So much
so-
funding. It'd be good to-
Any idea why we're not able to find someone? Is it-
So what happens is they want somebody that's gonna stay. As well as the board, the Board of Ed has to approve them too, whether they're appropriate for the environment. So they have to go through an application process, an interview process. So they're thinking, the Board of Ed nixed a couple of them, so that we were without a teen talk counselor for that
Is it
years.
the board itself or is it the administration?
Administration, I don't know who's on it, but they choose, they also have to agree to the Kids in Crisis counselor. So we did get one that started this fall, Carla, she's fantastic, and these are both 2 counselors that we feel, the board, the school feels, Kids in Crisis both feel that they can have a long term, but that their salaries are going up, and as a result. So that's something to think about, but it's so important. There are other schools that are trying to get Kids in Crisis into their school system. Kids in Crisis, they're maxed out. They can't take it. So if we drop out a counselor, they're gonna go to another school that's on the wait list, in another area, in their counseling area. So I really would like to,
So, 2
Yeah.
questions, if I may. The first is, on back to Silver Hill, 3 to 4 calls per week. Do you know what percentage are actually seen by Silver Hill?
so the Silver Hill itself versus outpatient, things like
But
that.
no, actually by Silver Hill, that they became a patient of Silver Hill.
No, and Susanna Lewis
I know she's on
is on
maternity.
maternity leave, and so
Right.
this was just someone that got me some numbers for today.
Yeah,
But we definitely will.
no, I just want to know, the 3 to 4 calls of the
Yeah.
46 cases, how many are actually being seen by Silver Hill?
At Silver Hill.
Yeah, that's. number
They
one.
had, in September, they had actually, of those cases, which were, then they had 3 that went to Silver Hill. The rest were outsourced to the appropriate need.
Okay, and then the second is there any reason that the Board of Ed, which is a much larger budget than ours, is then funding Kids in Crisis?
The
in
reason
there?
for that is, the benefit of Kids in Crisis is because the Board of Ed is not funding them. It does not go on the child's record that they came in. This is a separate entity and there's a lot of confidentiality and relief for the parents and the kids. So that's why the Board of Ed, they already have their counselors, they already have that in place. This is an entity that any child can go in there during this, they also have, 24/7 for crisis, kids in crisis, whether it's DV, domestic violence, things like that. They have a place, a haven for them to go. This is a 24/7. The school does not want to be a part of that, as well as it gives a sense of confidentiality and it does not go on a child's record, so they can go.
So my next question, I know that you had mentioned that we wanted to put the grants back to next month, December. Is there any way that Silver Hill can look at the kids in crisis as part of their program at all?
They're separate.
No, I know it's separate and distinct, but I mean, you have kids in crisis being referred, we funded a grant, ARPA grant, to take care of kids that are in crisis. I'm wondering if there's any synergy that can be created there.
I think this is where heavy teams, if I recall, from Amber, that basically that first wave of people that came in the process, by Silver Hill were teenagers.
But that was because we didn't have a kids in crisis counselor for so long, right? Or is that why there was a wave of people?
I don't know.
Well,
They operate in parallels, but the kids in crisis think someone needs hospitalization,
then
then they would refer to Silver Hill.
Well, Silver Hill wouldn't do hospitalization there. If it's an acute kids in crisis, they're gonna go to the emergency department. That's
If they need hospitalization, I mean, if they're referred there, Silver Hill would do it. Provided they have the space.
So kids in crisis, they have the counselors, the caseworkers. They work with. I don't,
I didn't think Silver Hill had an inpatient pediatric program, and maybe I'm wrong with
They
that.
have it for teens
well, I think.
and,
Right, so they don't have an inpatient pediatric program at Silver Hill, right? But in order to be networked into Silver Hill to provide counseling, I'm just asking, it's a bigger question, a bigger discussion, but this is a huge amount of money for us anyway. It's not as much from for others, but I'm just wondering if there's synergy there with Silver Hill to help with the grant writing and things of that nature, if they can be networked in some way.
What we would like them to do is that 250,000, work with that, and we're associated with that, and maybe have them decrease the amount that we need to pay. I think that route is easier to go in terms of keeping their program with us in-house versus asking them to help fund kids in crisis. I'd rather have them decrease the cost of this partnership that we have at 250,000. We're gonna have to start paying for that as well.
So the other thing is that the town pays only a partial amount on the kids in crisis counselor at the high school. It's heavily subsidized by other towns and.
Foundation, the community foundation.
Community
We also
foundation
have this
is-
discussion every year because it's
Talking about salary, but not the benefits or something.
So the 96,000 covers the benefits and the salary, and they, thank goodness, they've raised
That's
the
what-
salaries. These poor kids were coming in, they couldn't even afford to live in the area, caseworkers for kids in crisis, so they upped their salary so they can have some type of longevity.
So the 96 is the full budget for the staff person and their benefits.
And that doesn't include the 24/7 crisis that they also have that we are privy to, have access to in the event a child needs to be removed or does not want to go as a right to go home, things like that.
24/7, we part of the overhead. administration.
And that's where the New Canaan Community Foundation comes in, things like that.
It's a big grant.
yeah, they've increased their salaries, they weren't getting that.
They weren't getting appropriate, yeah, the applications, the experience, but they've upped it, but as a result, it goes down.
So critical.
It's so critical. So the report that I've given that you can read, the referrals that are coming to human services are incredible. But the resources are just as strong, which is good. So we're able to, Jackie and Marcy, definitely they're partnering and collaborating and networking with both sides is incredible. The schools with Jackie, the counselors there, excellent, and Kids in Crisis, every single resource that New Canaan has. And this is one of the reasons why we're upping the grant request money for this year, because it's the most cost-effective, efficient, and right to the source of the need of the child, of the elderly, of this and that. So it's coming. It's a good machine right now, but we need more money. If not necessarily, we don't need more people. We have that. We need the money to maintain this, to be able to use these resources without having to create a whole department by ourselves. With 20,000 people, we just don't have enough.
Should we have schedule a report on the Kids in Crisis counselors and how they're doing? Is that something we should have on agenda at one of the upcoming meetings?
So I sent out a child guidance for this grant. We have sent out, there's all the information, Kids in Crisis.
But
Now that we have the middle schooler starting this, yes.
maybe once whenever it's appropriate.
Let's see, yeah, I'll see what their data is.
Yeah.
And see what we can send out. Definitely I'll do that, but I do send out the child guidance to every quarter they give us, and I do give it to you.
Great.
And
You see that?
attachment.
Our guidance report last quarter. 14 New Canaan kids rated from 6 to 17. The diagnoses are 50% kids adjusted disorder, 29% hyperaggressive, 21 anxiety, depression. Autism, developmental disabilities, 7%, divorce, 21%, suicide, 7%.
Was that shared with the commission?
I think.
I didn't get it.
I'll send it out again. I did the yearly one too. I sent the fiscal year. So
I think we all, and I'm speaking for just myself, I think we all agree this is critically important to have in our school system. I'm just wondering how this is dovetailing with Silver Hill and their support with the other systems, the hospital systems, and you know.
So the urgent assessment program at Silver Hill, they also have the New Canaan Behavioral Health Alliance. They're running that. Kids in Crisis, child, everybody is there working with them. And it benefits our residents, because when someone comes into this assessment program, they have to do a gentle handoff, and they need to know these point people. So this is who they're working with, and generating, if they don't qualify, or it's not needed for them to go into inpatient at Silver Hill. They are definitely valuing all these organizations and agencies that they're working with, and they do a right now. Once again, Susanna Lewis, who's the coordinator of all this, she went on maternity leave. So we're sort of at a skeleton movement.
Can I just add though, because I think from my experience, when my kids were all in school, having the counselor in the school, and they get to know her, and she sees some key thing, and then they, are more willing to talk to her. I think it's just a huge benefit, and you can't underestimate that in person. Yeah, and just having that person, they know they're there.
Yeah.
They can wander in after school.
They do, and we provide snacks for the counselors, so kids can come in and have a breakfast, a quick, finger food type snack. We supply that for the SROs as well as the Teen Talk counselors. It's expensive to pay for that. So
Then they have a
the food pantry, we have a donation for
Who
kids.
supervises them?
I mean,
For this 96, who oversees the work that they're doing?
It's an organization that oversees, yeah.
It's more just that.
There is some interaction between Silver Lewis and.
Head of Student Services.
I'll tell you, for giving thumbs up, they have Fred Stone, who did meet with us 3 months ago. Yeah. And the reports on the new hire for snacks are very positive.
Yeah, very
Quick question. One of the things is we're gonna be asking for more money for both the health and the human service departments. Are we laying the track, because now's the time of negotiation for next fiscal?
The budget season doesn't begin until January. We meet with Kevin in December.
Well, except the track is laid now. So you have November and December to pre-sell, because we're gonna be asking for more money. My point is, because both departments are now doing a lot more work than they had been doing before, there's gonna be a need for thinking about from. both
My budget's
departments.
not going up that much because,
Well, that's because you're getting subsidized.
Well, 'cause because I'm applying for grants and taking off that money from the town liability.
So Greg Riley, and also I talked to him about this, the Kids in Crisis potential grant. The issue is Kids in Crisis applies for all the grants too.
Right.
And it's appropriate. I mean, they do get grants and that's why.
But I'm thinking more department budgets, whether there's a need that you guys should be thinking about. The farmers are asking for more for outside. We should ask for more for inside, because we'll never have a better case in terms of the COVID crisis and all of its manifestations. Anyway, so just point out.
Well,
Yeah.
Kevin and all of them have been very supportive of the health department, so I must give Kevin credit on that. I've had no issue. And, you know, the grants and everything help with my nurses and all the other stuff that I'm doing. I'm still working 1,000,000 hours and, you know, we make it do. You know, I don't ask for money just to get money. You know, I'm very cognizant of the economy going on and everything else. So
The couples therapy-
we've already submitted our budgets.
The couples therapy must be working.
Yes, it is.
So yes, Human Services, Jackie gets a grant of like 26,000, that helps. With some of these things, we get another grant for 46,000, that's from the state. I do that for the Get About transportation for the seniors, but having Greg Riley come on, I think is great, and we're looking at the urgent assessment program as well as the Kids in Crisis. So to see where we can qualify for more money, that's what we're going for it.
Great if Greg can fix the advertising.
Yeah.
Yeah.
I don't think that's.
Oh, I know, and that's another thing that you see the marketing, the cost is so expensive that you need to discount. But, you know, it's all in the notes. Does anybody have any questions or?
I just want to say, I think the holiday gift basket program sounds great.
Yeah.
But we only have 25, yeah, I mean, can you discuss something when you volunteer?
This is a pilot program,
Okay.
so Missy wanted to, we'll put that this year, 25, the adopting a holiday basket, adopting a senior. And Marcy just gives a little bit, very benign, saying, elderly female, has a dog, enjoys gardening. That's it. I mean, it's something that they can.
They don't,
It's
it's
just
not
an
an
idea.
idea. Yeah.
It's an idea what to put in the basket.
Having something about adopting before, you know, when
Yeah.
you're living alone and.
Yeah, and it's not all those in need, like the food pantry aspect of it. These are people that can afford to live alone, but they're isolated. So there's that aspect as well. It's not monetary.
The food
Pardon me?
pantry, is that-
So you're doing the poinsettias. We have a whole crew for that. And we'll see Marcy wanted to figure out, the baskets are coming in at different times, not just all at once. So she's gonna be delivering them as they come in.
Okay.
So that's what we want to see.
Yeah, that's so
Um,
Yeah.
Okay, I think we should move along now. Stephanie mentioned full business, Stephanie mentioned marketing, just brief history, so a couple of comments from the community, North Community Foundation. President, people served on Waveney support, financial aspect, et cetera, talked about. That HHS should be marketed better in the community, so we looked at that, we looked at doing something in the advertiser, the New Canaanite. Stephanie got some numbers on it, we tossed that around, we were gonna do golden years, which is supposed to be in October, but.
Here,
I didn't
it
see
is.
your probably.
It's in there, it's in there. It's in
It's
there.
it's in there, yeah.
That's great. So we're now, and then after our last meeting, we thought, well, maybe other than going to the advertiser and et cetera, we could just do a letter to the editor and put it in both of those. So that's where it sits right now. So a little bit of the backdrop, though, our first selectman, Kevin Monahan, did say there's voiced his opinion that there was no need for marketing advertising right now. We're busy, and at least at this time. Honestly, they can attest to this. They are inundated, HHS, with new families, putting them up, et cetera, et cetera. So it may not be the time to do this, but I'll leave it to the commission to decide. You want to comment on that? Bethany, wherever
So
you-
we have about $4,000 left in the public health expenses, and I could put this under public health. So with the 4,000, we already spent that right there was not $900. That was $900, and you can see on the notes how expensive this is.
Yeah.
So we have $4,000. I can pull from somewhere else if needed.
We don't need more business at this stage.
Yeah.
I think it's a waste of money, and stuff, but the other thing is
Yeah.
we are in the holiday season, and every year we've got something that the advertising. the community.
Don't drink and drive. Yeah.
Yeah, alcohol, substance abuse. We're after the mover with that, and I think it's a good thing, and, that's the primary focus of that, but there is the sidebar, it's also marketing, and people are aware that you're doing something. in the community. So,
We get the free marketing for the town, Instagram and Facebook. That's no charge, and we can do that during the holidays. From the commission, no drinking, no driving, signs of, have someone else drive, all these PSAs. So
Why don't I have,
question is that enough?
that,
why don't we have somebody write a story about what we do?
Yeah, I'd be happy to help with that.
Because that's free, and that's more interesting
well,
than
that's
what
what.
stupid is.
That's what the fire marshal does. I did that last month.
Yeah,
He does his little tips of fire safety, college safety,
yeah, I think.
and it's free. It's a letter to the
Yeah.
editor.
Can I just make a suggestion? Yeah. I think because it's the holidays, I mean, of course, you can talk about something like drinking and driving, but I think it might be nice to share with the community everything that Human Services does, especially around the holidays, and this point of we support seniors and youth and, and all kinds, not just people with socioeconomic needs, but the whole town, and just sort of a nice, I mean, it doesn't have to say, you don't have to be looking for business to just say, here's what we're here, and it can come from you.
That's our soft approach. We're here.
Yeah, I mean, I don't know how everybody else.
We could use Greg Riley to do that. We couldn't get a better reporter.
Did I hear you offer to do something for free?
It's so important. I didn't want to get
Mark was tired of this, so she's got it.
That's my job as a woman. Maybe you and I can work on it, because I think it would just be nice to point out, just how.
Well, and I also want to say in terms of like, we don't need more business. If there are unmet needs out there, we should be looking for more business. I mean, and so, if that means like going to budget season or next year, there needs to be a bigger department, we need more, like there are unmet needs out there, right? And those people don't know where to go. And so if we're inundated and there are still unmet needs, maybe the department does need to get bigger. I don't know. I'm just saying, like, I don't want us to
That's our
say,
next discussion, right, Mary?
Yes.
but just keeping in mind that, like,
Right, but before we close on that topic, do we want to do something to address the alcohol substance abuse, or we just want to let that ride for this year?
Sure, I mean.
Mark said, sure.
No, I think I would have actually like, here's, we're here's addressing systemic issues across the community, not just, that could be one, but I think that's a different message, but I don't know why you couldn't do a blast on that or a PSA, right? I think it's, I mean,
Is
it's
that
really
the
important.
topic that we think is the most pressing, domestic violence, substance abuse? What do we feel as a commission is the number one pressing issue during the holidays?
You know what
Pressure,
the number one
anxiety.
issue is that was picked up by this state survey that just was concluded by the Denver Hospital, alcoholism in Kenya. Number one.
I think the drinking and driving,
Yeah.
or under the influence, driving under the influence, I think that is the most direct. That could be a little story. You know.
Interview, you know,
Yeah.
Good work with the PD on that.
Yeah, interview the chief, yeah. Yeah, it's free, like Tom said, it's free, you know, some stuff in the paper.
Yeah.
The problem is the advertiser, I don't think it's reading it. I don't know.
Yeah.
Getting some campaign, and I think it's a great also, but I don't know that it's reaching everybody. It's hard to know, and he can be funny, Mike can be funny about it, you're gonna run the advertisement, you know, so that's me.
Really?
Well, and I think another issue is everyone, maybe I'm speaking for myself and generalizing, is getting out, we're inundated with information all day long, so you just know to, like, I don't even see ads, like, I think my vision blurs or something, I don't check my emails like I used to.
Right, oh, interesting, so maybe some copy, some actual story.
Yeah.
Might get you, yeah. I
Okay.
think it's worth trying.
Yeah.
Next item, role of the commission, so. The perspective on it, role of commission is one oversight, two advisory. Advisory means advising ourselves, the commission, the staff, or the selectmen, town council looking at about the unmet needs of the town. So we have our tentacles out in the community, and also to inform the community of what to advise them, what services are available. So those are two big topics, but I know it takes many different angles to the role of the commission, so. To the floor for comments, suggestions, whatever.
Well, the town charter has a description of our duties. It's not great. Finally looked at it.
How many years ago?
I think a number of years ago. But it says, powers and duties. Establish policies and procedures to assist residents. Shorthanded this stuff, with critical needs, food, shelter, safety, and health. Recommend and incur expenses for public welfare and related to the prior. And then this one, the town shall keep itself knowledgeable of the needs and conditions of the health and general welfare of the citizens. And of the services in the areas provided by public and private agencies. And then develop and coordinate information programs in each functional area. So I think we do a lot on the oversight and establish policy and procedures, and the departments run great. I think in terms of knowledgeability, we get a lot of anecdotal input all the time, but we haven't done a systematic review of what needs for a long time. And that's significant undertaking. I have not thought at all about how we would do it, but that would be an interesting idea to decide whether or not we want to pursue.
Did Newark Hospital do a community assessment that was supposed to be shared with us?
They haven't given us the data yet.
They
Maybe
did.
Peter can help with that.
Yeah, one of the things that I think of, and I read the charter a lot just to remind myself of why we're here, is defining what a healthy community means, right? And setting priorities, because as we've all seen, there's 1,000 priorities, 1,000 people who are in need, but we have limited resources, limited time. And what are those big key issues that we're going to put a huge focus towards, more dollars towards, in order to try to move the needle? I agree, oversight, advisory, informing the community are important. But as I read through that, our charter, again, it is really defining a healthy community and how to make this a healthy. And to me, that is, and giving as we advise the Board of Selectmen on what the budget should be and where the funds should be and where they should come from, I think that's also fits within that purview.
I think it's a great point, and to me, the key is developing those core priorities, because the second we start getting into funding, there's just it's coming from so many places, but if we can be clear about the big issues, then funding, everybody can kind of pay attention to that, the Community Foundation, all the grant action in the town, and private philanthropy. But there are 4 or 5 issues that are not just today, but emerging, right, to stay out ahead. That I think is the great work. So I think we've got to be in a information consuming body and getting presentations in sort of all the time, listening to the services area, and then developing real discernment around the big issues now, and especially the stuff that is quietly emerging. So then I think you can have real credibility and be a huge aid to the Community Foundation. I personally think there's big opportunities for private philanthropy if told what the real big issues are, not to mention the towns. I can see that being pretty powerful, because no one else is kind of always taking that view, the bigger view, really informed by all the smart people around, and then making statements. Then will become a bit of a beacon to create alignment instead of the feeling of this whirlwind of, like even the kids' crisis discussion. I had a spending dollar where the money was coming from and all that. We're just clearly saying, hey, kids, mental health right now, tsunami. That's an important statement. That we make clear statements. I can just imagine a lot of good coming from it, because the challenge for me is like, where do we end and everybody else begins? Because we've got some budget, but the dollars at stake are really, they're out there. There's dollars, but they don't quite know what to do. And I think if we really start establishing that through this kind of dialogue, and speakers come in, we'll know more. And we certainly have access to all the smart people around to develop that kind of more strategic sense of things.
I mean, some of it will have to be is directed to that topic, to kids in crisis, to the child guidance. So we would become equal at that level, maybe. It's, you don't want to interfere with what they're doing and what they're getting. And now even with the silver hill, once they get beyond this ARPA funding, and that's going to be another big source of what need for funding.
Therein lies the issue, because I'm doing work at the state level on healthcare, labor. Everybody's talking about the next ARPA, which you can recall is $1 trillion.
Yeah.
That ain't gonna happen then, and Carlos Switch party takes control.
Inflation.
So the net of this whole thing is the last major project the commission undertook was 2010. I'm looking at senior needs for the next 20 years at the request of the Board of Selectmen. Out of that came telehealth, came the 25 benches or 23 benches that and tax abatement, some other things that most importantly created the optimal livable community planning model, basically, which is still being admired by AARP and other people in Hartford. We concluded that there were not a lot of things that were missing, but there were some ways of getting things better organized, staying put. Sort of came, I think, in the wake of that also. So from the standpoint that, we don't have any totally unmet needs as far as I'm concerned, and whether we're talking youth or seniors or any of the public health issues, but we could take another look at revisiting, because one of the revisiting seniors, because one of the things that was recommended is it hadn't been at that point, Dave Hunt is the finder of this fact, but it hadn't been a multiple housing operation for 30 years or something. Well, guess what, guys? There's now a lot of multiple housing going on. You might want to look at putting that up on some kind of a matrix is how much of that is helpful and.
You know, when I was at Stanford, Penny Young has been involved in doing research on what seniors need since, I don't want to say it's 1970, I think it was the first study. And so I did a little analysis I might have been at that meeting for our advisory council of all of the different surveys over the course of those years, and I'd be happy to share with everybody. But the one thing that was missing was senior housing, which of course, independent living. Living situation like you've never seen. So I think, yeah, the current project is important too, but it might be good to just for everybody just to read that, because I think it might help see that, yes, in general, you know, we're doing a great job.
Well, I took that, because that got to Kevin's desk.
Okay.
And he called me and said, "Gee, maybe we should revisit that." Now, this was in the wake of the Waveney,
Yeah, so it's.
thing on auto, and when Clark's first effort at building on Elm and was, that sort of then
Right,
blew away in terms of other important things going on, but that's still, there's an opportunity, and we know that that's something important.
Yeah.
Kevin was on the old first senior housing committee that came out of that 2010 work. If you notice, he's interested.
it's very positive.
So it might be interesting, and this is a point, we're not short of, certainly solving getting a lot of multiple housing.
Well, housing projects are the way.
Can I change the subject, because I would like to share my research and maybe we can talk about it. I mean, I want to get back to what Peter said, which is, as a commission, I think something very important is for us to identify the 4 or 5 most pressing issues that we want to focus on, because you're right, the funding, the decisions about funding should come from that, right? Here are the 4 things, and then, you know, if your priority is kids, well, that makes it easy to say, let's go to that for this or that. But one thought I have is perhaps we could get Lauren Patterson from the foundation to come in and talk to us, because she has her finger on the pulse. She gets grants requests from 30 organizations all across the county, mostly in the 5 communities, you know, surrounding ours. But she certainly was one who really started the mental health initiative and partnerships. So maybe to get her perspective on what does she think are the most important ones, and also, as you mentioned, you know, what should we be looking for that's coming down the pipe that we don't even know exists. And because we, you know, she does fund also these same organizations, or the foundation does.
And to your point, Barb, they should be measurable outcomes, like Peter, we deal with Norwalk Hospital Board. It's like all my grants, they have to have measurable outcomes. You're gonna do this, how many people were served, blah, 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 because data drives everything. It's great to say things, but you need the data. How many kids are serviced by the counselor at the high school, things like that, to show, and people are visual learners, and it helps back up.
Well, then
The need
Peter's
for
point, we
it.
might be able to get private funding if you say, look, this is a huge need,
Right.
look at how many kids are getting served, but we need
100%
$10,000,
agree.
you know. So,
But how do we get the input from the experts, because we can get.
Well, if you're providing them a grant, they should be providing what
they do reports,
is
yeah, they
going
call
on.
them reports.
When you see when they propose their request, and they have to give the information. So when I send this to you for the 6 or 10, whoever, I don't know who's, everyone's going to request any money, but I think about at least 6 to 8 will. That is all in their report that they're giving me. This is part of it. So definitely read it. Take the time. As I get each one, I will send it over to you. They have until November 14th. But yeah, this is part of the process. So there might be vital information in there. If you need different information, let me know. I can contact them and get that information. But it should all be included when they submit.
Jen, you mentioned Norwalk Hospital, like the study they won't share, but then what studies have been done as the needs? 'Cause I could sit here and tell you what I think, everybody else. But I think this think probably be 50% overlap, but if is anybody actually worried?
Well, that's what the
Yeah, the
community
share.
needs assessment was.
Yeah.
And,
I mean, just being slow in sharing it, or are they not wanting to share
no, they just shared like the aggregate data, but not our specific New Canaan. So it's not helpful to me if I don't have New Canaan. And, no, I've asked. That I've been asking for New Canaan specifics of my surveys. Oh,
In
what-
2019, they did a sub-ed by community.
Right,
That state data.
Look, I think, you know, in the interest of time, I think we could pick 2 or 3 for next meeting that we could set up. I mean, for example, it is just alarming to me how many five boys and 2 grandsons that we have. In the last 90 days, you know, 6 people between 10 and 17 who've had suicidal ideation in our area. So that's an actual measurable piece of data. And I think if you hold everybody in New Canaan and everything, you know, we're all overachievers and everybody's managing their own business and not having problems. And this is truly a crisis.
Just really, the community has been saying this all throughout COVID, that it's becoming more and more of an issue and it needs to be addressed, and we just haven't gotten to that, take the actual steps yet. But I do think everyone that I talk to has that on their radar, especially with the suicides in Darien.
Yeah, so I think Bill and Peter's point, and I think we're all saying the same thing, been saying it for a couple of months now. If we're going to pick those 3 or 4 things, have a presenter come in, and maybe there's some overlap, right? Maybe there's some overlap in what other people are doing, and maybe we can help focus and bring that synergy together through our 2 departments here to bring more focus and attention to it. I think that's my
So what are we
recommendation.
looking to do today? Maybe come up with some of those?
Well, I think it'd be great to have a goal of 60 days from now that we have a full-year plan. To give them enough time, because these are dense problems, there's data, but then there's people have a
Human
feel for
interest,
the
yeah.
community and all of that, and, you know, to have a couple like key people like Lauren, that's obviously fantastic along those lines, and just bring it together, and give ourselves a deadline to, you know, maybe January, something like that, and then put together 4 or 5, and then we really go from there.
We know what the topic is. So number 1 is mental health. So we've discussed kids in crisis, overdevelopment, child guardians, the private therapists out there, clinical social workers, psychologists, psychiatrists. You know, how do we impact more? Jackie sends out reams of information to families regarding all of these psychosocial issues. You know, what do we do more than is being done?
Well, mental health behavioral health is such a huge umbrella that I think we would need to try to delineate within that. Are we talking about kids in crisis through that big umbrella of behavioral health? Are we talking about substance abuse for adults, for seniors, substance abuse, senior isolation and depression? I think mental health and behavioral health is such a wide umbrella that I think we need to pick something very specific within.
And I think there's real work to define these things, because you're right, so we have a general feel, but to be as clear, it's just, it takes time for us to talk about and digest.
What do we do over and above what's being done? So I was about to say, maybe do we delineate an area of substance abuse and become very active?
Well, that's where having
Financing.
Yeah, I think, and also I think what we do should be related to what Bethany funds. You know, I mean, we should look at these as what you think are the critical issues, and we should.
Yeah, these are the agencies that
That
we
fund,
do.
but child guidance, I mean, child guidance does everything from, you know, so picking up kids in the middle of the night to giving food and buses and subsidies for school, all kinds of things. So that's a huge organization. It addresses many issues, but, you know, we want.
Yeah, and the age spectrum is, if you look at the grant request, there is an age spectrum there between children all the way up to seniors. New Canaan Cares is for the whole town. Meals on Wheels, elderly or homebound. Kids in Crisis is,
Yeah.
Get About is more for the disabled and elderly. So this is a really good key of why we ask them to.
Right,
Fill
so
out
those,
the request form.
you would probably have the components of these 4 categories, but I think there may be something that we're missing here because it's up and coming and, you know, we don't really have, you know, complete understanding of the big picture. Beyond, I mean, I'm not saying you don't, but I'm just saying that's, you know, within the bigger, you know, some of the other issues that are going on, so.
One thing, I would look at Janet, she's got a very defined area about what she does, and it's a full-time job. more than jail. So that's, I
But it's in
don't know how we do anything to supplement that, if it's needed, it's not defined, if whatever, she's got everything. Human services, same thing, Jackie, Marcy, Bethany are very busy with what they're doing with new families, et cetera. I mean, when we talk about getting more involved, other than, you know, being sensitive to community needs, et cetera, what do we do? Is in our local Department of Health and Human Services? Do you hire more people? Do you then become substance abuse therapists or whatever? So it's like, you know, we have a certain role that's somewhat defined. And all these things are good and the community needs them. But is that really what are presently defined in how they operate health and human services?
But I think our view here, so we should take the broader view, because we're not on the phone all the time dealing with all of the issues, and we've got a broader view. We have the right folks coming in to concern and help prioritize. It's not easy to do, and I think we are uniquely situated to have these kinds of conversations, and you know, we're not going to figure it out like right now. It's takes work and nuance, and that is, I think, a hole in the ecosystem here of taking all the input, the huge amount of data, all what you guys are experiencing along and seeing the patterns and frankly the emerging patterns, and come out with a forward-looking view of what we can do. So in this ecosystem, there's so many people involved, so much data, trying to figure out, well, what can we uniquely do and oversee the emerging trends and kind of get a jump on things that everybody else can respond to, because we're obviously not the most important players here, but if we can play that role, stimulate thinking, you know, the community foundation where they could launch some philanthropic initiatives and maybe, you know, Jen could go, you know what, that is a really big deal. And I think if you could fly that out there, that would be beautiful. I think this would be a unique service that this commission could do. And to your point, not be duplicative and not be poking around in like the minutia of different budgets, because, you know, they know what they're doing. They're doing a good job, and we're not second guessing, just trying to give them even the broader view of what we're seeing that I'm sure would be very stimulating.
And that's what the request is so important. I mean, my budget has not gone up in terms of operating budget. That is flat. But it is these grants, because this is what the caseworkers are seeing evolving. This is what we need more, our catchment area. Catholic Charities has been incredible. These are the grants that we need to meet the needs of the residents. So, and this is how we keep costs down in terms of hiring someone. There's not a full-time job for each agency that we're willing to give money to. There's not a full-time job for someone, but amongst all 10 agencies, this is what Jackie, Marcy, and I are manipulating and making sure with 3 people that we are getting these resources out. And when we say, you know, people, there are needs out there, and there are unknown needs, but more and more people are learning where to go for help. They are learning, and access to 211, being told to contact us, going online. We are there, and a lot of those unmet needs, they have to come to us. We can't go out there and say, you know, you don't really look well. You look like you're in rags. You need clothes. I mean, we have to have this self-determination, respect, and dignity as well.
So it's a great point, Bethany, and one
Yeah.
issue that I think we're seeing with the urgent assessment right now.
Yeah.
The people really in the know that access to information is a huge, quiet problem here.
And that's where the foundation, the community foundation, yeah.
And I think we go to a hospital, it's the same thing, blizzard of where do you go?
Where to go.
And this is something that the commission would say, by the way, there's a hole in the information chain, which is really stopping so much from happening, which is there one number that I can call where I've got a real problem on my hands that's safe and all of that, and then it gets distributed to the community. that is something that we could discern, even though it's not like really obvious. But it's a theme across everything. It's those kinds of things that we could double down, and I think like the urgent assessment personally is something everybody should, plan should be involved in that. I mean, forget about ARPA. This is something that is urgent, that's causing a huge
This is
uplift in
especially
safety. in our
yeah.
community.
The other thing is there should be not just one number. There's no wrong door when it comes to mental health. And that's why it's important that all these agencies, that's why we have the Alliance, Behavioral Health Alliance. So no matter what phone number you call, you don't have to find the right one. You gotta find a phone number and to be able to get to the sources that you need. And so that's our big thing is there is no, well, every door is the right door. And so maybe you don't have that number, but the person you call for help does.
But every door, I think what Peter's saying, and again, in the interest of time, and
Yeah.
not every door is open 24/7, right? And so one of the things that we've talked about, Human Foundation and others, is having a 24/7 kind of number that could come in and 365, where you can help that person or that family go, here are the services that are provided, and it is you can sit down, you can follow up with them to make sure they got through, you can help make that phone call or make that connection. So, that could be what comes out of this assessment, is that we need a 24/7 hotline specific to our town where we can help direct people, because this suicidal ideation, which I'm still keep focusing on for kids, which is scary to me as a parent, is maybe happening at 1 o'clock in the morning, and maybe happening on a weekend where nobody's picking up the phone. So that may come out of this group, as that's the recommendation we're making. We want to go after grants. It's not something maybe we can do or want to do ourselves, but who else can we support to do that and find the grant money to do it? It's the way we came through Silver Hill, right? Kids Silver Hill be involved in kids in crisis in some way. I'm not saying they can, but maybe they can. Maybe they can work together in collaboration. That is what I think our charter was set up to do. Right? Whoever came up with our charter. God bless them.
He's been around so long.
Exactly.
Hey, Jim, Tom, are you calling him old?
Tom Moses Ferguson.
I couldn't assume that whoever set it up, had a very specific idea how it would work today, so it's kind of up to us to define how you want it should work.
But to Harrison's point regarding the health department, everything I do is dictated by statute and public health code. And I have the state health department as an albatross around my neck every single day. And every time the legislature puts pen to paper, more and more unfunded mandates come to us. Whether it's the frequency of, restaurant inspections, whether it's the salon inspections, the pools, now there's mental health with the QPR, We are at local health level drowning, and there is no magical staff, even if I got the money to hire. The sanitarian crisis in Connecticut is unreal right now. So we don't have the workforce. Jim and I have talked about this several times, and the directors of health have talked about it. So, I'm more than open to, doing more things or whatever the need is,
Well, maybe the exercise will help us identify something that's important, and we can then support you with additional. I'm just throwing that out, I'm just saying. But keep in mind that we're trying to do what we can to try.
Well, there are more in healthcare, there are more regulations coming.
Well, that's true.
It's like waiting.
There are towns like creatures of the state.
Yeah.
Kind of runs
Yeah.
the show, and that's it.
But
But
it-
we can execute it.
It does sound like you need a little more support, potentially getting ahead of, maybe you don't have time to tell the legislature to stop writing down.
That's me. I've been on to Tom O'Day and all Rex, and they've been very supportive, but they can only get so far. Because, we don't get per capita funding. Any town under $50,000, 50,000 residents doesn't get per capita funding, which is huge for the health department. Where Bridgeport and New Haven and all these other towns are getting all this extra money, we don't get that. But even if I had the money, say money is not the problem. There isn't the people to hire that have all the licenses and the degrees that are required for the health department side of it.
If we try to tie this in a bow, and I'm trying to, as chairman, if trying to tie this in a bow, would it be appropriate for each of us, we all come to this meeting with different perspectives, right? To write 2 or 3 things down and maybe use those 2 or 3 things if we can get a consensus. I think there's gonna be overlap. To then say for this meeting on December, we're bringing in Kids with Crisis, we're bringing in the Community Foundation, right? So this is our agenda that day. We're gonna look at that and say, okay, do we all have a consensus that this is a priority? The next one, here's the next one. And then we make those decisions. And then, I agree with Peter and others. We should be able to then go to our grant writer and go to people and say, this is what the commission is willing to support, give full support behind. We need to go get those grant funds to support that level. Very specific, behavioral health is it's too broad of a stroke.
Yeah, just to get back to you, the 24-hour thing, so I was involved early on when, so we're going, moving to do what they're doing now. And the first floor, 24/7 coverage. Because I'm not right, I have been on the front, things happen on Saturday night and Sundays. And it's, I was disappointed. I walked away from it. So it's like, and then you also on the 24/7 thing, you have to get competent people on the other end of the phone. So Jen's talked about Manpower, it's everywhere and every facet of healthcare and maybe all other areas too. So it's, if we could have a 24 hours, 7 deal and have some competent, 3 people on the other end of the phone to direct. And then they do this for 6 months on a trial basis. And they got 3 phone calls in 6 months. So you don't know, because there are so many competing factors of it. It's hard to say, but even as we move forward with the Silver Hill, if we could expand that and they put the brakes on to an extent of how many people they see, et cetera. So I did, I mentioned the last meeting, I had a former patient who has suicidal ideation and they contacted me, et cetera. So I made the call and I said, listen, I'm just gotta tell you one thing. You live in Darien, so it's, just having to make it for free. Money portion was not the issue. So, to expand even something like that, where it is a 24/7, get the physicians, get the social workers, get the PA to do the physical part and have that going, it would be a great thing. But, at least for the time being, but things like that, I consider being a positive.
Yeah. Agree.
I like the idea of everybody taking a sort of their own personal, stab at what do I think the critical issues are, and I might argue that we've done, like, we know Jim's already done. Jim's already charged. But I think rather than, yeah, I know you do, but I'm just gonna argue, maybe rather than just bringing people in at the next meeting might be a discussion of everything that everybody thinks about and trying to come to some understanding, and maybe we can get back and try and get input from Lauren in advance.
Yeah.
Right, just ask her to sort of, what do you think?
I think we should put them on it, I think that's good. This Jim referred to you.
Yes.
Both the 2 things. Senior housing, I think we addressed that issue. Know Your Neighbor project, which is something that we could address at some point in time, the wellness and exercise program. I don't know, the why is so good here, and have the over here there.
Yeah.
I don't know if that would.
How do you go from that?
I'm involved with JHS.
They keep going back to what goes on in Camp Springs and that's.
We should go down and down what goes on. Yeah, you know that thing.
Weatherizing or pitches out there.
Possibly if it's something that would be a project for the group.
I know, we can get big ones on and all that. Yeah, we can put the gloves on with the sandpaper and go.
Yeah, look for laws.
That's really big. Although listen, the people have to use
Jim, Public Works do that, will they take care of this?
And a lot of those are well, even though they're, well, we sort of tied and written by public works.
Get them involved.
The benches are the part.
But the concept here was exactly what you're talking about. This was to be a catalyst event, and that everybody would come up with.
Peter, Barbara, then the other ones out here, just slowly. That is how, like the great things to the next meeting. There will be other issues on the meeting. The new business commission members, that's actually more of a next meeting, but some terms are expiring and, always free list. The term when you sign on is 3 years. So sometimes you're filling someone else's term that left earlier with them, full scramble. We'll deal with that in December.
Great.
Thank you again.
Yeah.
All the everyone.
Yeah, it's,
Yeah, we can move.
Get you, yeah. You're getting a bride.
yeah. We're still recording.
Jim Woodford, one of our members for but he also works for the state of Oregon for development. It's becoming more and more and more. It's just literally. We were.
He's like, "Oh, God, I'm gonna be so much better." Oh, you have to get it, you know, right? And I was go for the next one, last September. Yeah, the word was the night that I hated it.
Do you know my? My EOC, my first 2 months, I'm only at 7.